a very big role in the world in general. We know that African swine fever is a disease, is a highly contagious hemorrhagic disease of pigs, affecting all breeds of pigs, either wild or domesticated ones, which is caused by the African swine fever virus. It is a notifiable disease. It is a global animal health priority. It has a lot of socio-economic importance and a transboundary disease. So it is very important, especially now, even with the COVID-19 pandemic. We are talking about economics. It causes a lot of economics. You have said it's over 300,000 pigs are lost. We're talking of over 3 billion naira lost. So it's a very big issue and it's something to worry about.
Now, I'm a bit worried here. Dr. Mana, what is the transmission mode of the disease?
Thank you very much. Like you had said, that African swine fever is a highly contagious hemorrhagic fever of domestic and wild pigs. Mostly it is transmitted by either direct contact with infected animals or diseased animals or products of the animals, or indirectly through either formats, including maybe feeds, items on the body, boots, clothes that are in contact with infected animals, or through biological vectors like ticks. So those are the major transmission routes for African swine fever.
Then, apart from the consequences on livelihoods already known to us, what other challenges are likely to arise from this outbreak?
Thank you very much. Primarily, we have, although African swine fever is not a zoonotic disease, but it causes a lot of trauma, mental, emotional trauma on the farmers. It is a means of environmental pollution when you see the number of pigs that die when proper disposal is not ensured. And so in terms of environmental consequences, it is there that African swine fever, because of the high rate of mortality in large pig farms, can constitute serious environmental challenge. Apart from that, the infection in humans, as we have been told before, has serious socioeconomic and production consequences, because large farm can be devastated within a very short period. It is also an infection that cuts across international boundaries. So it is a trade-limiting disease, making it difficult for us to have access to international markets because of the virus. Thank you.
All right. Dr. Baju, he has spoken a bit about the economic consequences. And so I'm wondering, and that will give me an insight into how much Nigerians consume pigs. What consequences could this hold for the Nigerian economy, whether directly or indirectly? There are fears already that demands may not be met, demands of consumers.
Exactly. Apart from the economics, I mean, in terms of naira and kobo, we're talking about loss of over 2 to 3 billion naira, which is very, very recently. There's also the issue of food security, because there are some people that depend on it. These are a major means of meat supply. So when this is cut off, you now have a major shortage in the food chain supply in the community. And now we have already a pandemic. And like my colleague said also, there are other issues involved. Thank you.
Now, if we talk about, consumers not quite being able to have their demands met, on the economic scale, talking about the whole country, already this has only broken out in the southwest. How much impact can this have? Are there areas where these things are usually transported to outside of the southwest? Or is it for the consumption of those in the southwest, Dr. Aisha?
Definitely, they transport it. Even the sale of the live pig itself, it's being transported down to the northern part of the country. So that one will also be seriously affected. And I can tell you, especially now with this COVID-19 problem and so many other issues, it is going to compound it. Our government, we know, recently has invested so much, they are putting so much in the agricultural sector in this country. So with this one, it's going to be a huge problem, economic problem, both on the humans and the animals and the industry itself.
Okay, Dr. Mana, is there a chance, yes, at the moment, it appears that there is no connection to humans, talking about the flu. But is there a chance that this could be contracted by humans, given the history of COVID-19 with animals?
Well, I've said it before that for now, African swine fever is not a zoonotic infection. It's not a zoonotic disease. So it does not affect human beings. It has, in terms of public health consequences, it does not have direct public health consequences because it is not transmissible between humans and animals. Okay.
But is it only limited to pigs? Does it go, could it be transmitted from the pigs to other animals?
Well, now it is it circulates between domestic and wild pigs. For now, African swine fever circulates between domestic and wild pigs, so it's not been recorded in other animals, as it were, currently.
All right, Dr. Aisha, if we can, have this transmission from animal to animal, what level of infection does an infected animal, what level of poison does it carry? Can it still be eaten? Is it consumable if a pig is infected?
We don't encourage eating it. Normally, once a farm is infected, we do total depopulation. The whole animals are destroyed, we depopulate, and then we go into biosecurity, clean it all out completely, you clean it. So, and normally what is obtainable is that once you depopulate a farm, then you compensate the farmer. That is what is obtainable. We don't encourage slaughtering and feeding and giving it to humans.
In other words, is a community where this infection is found, is it safe? Is the community safe for those who may live within that environment?
Yes, as Dr. Omana said, it is not a zoonotic disease. The zoonotic aspect has not been documented. There is no transmission between animals to humans. But of course, yes, as he said, when there's the mortality is very high. Sometimes you can have mortality of up to 100%. That is so many animals dead at once. So even the smell from decomposing dead pigs is enough for you to be to cause discomfort in the community. So even where you're going to destroy them and so many things, so it constitutes a lot of environmental nuisance actually.
But is this the first time that we are going to have the swine flu in Nigeria?
No, not at all. It's been here before. Yeah.
Where did it originate from?
The first documented case of African swine fever was in Kenya in 1921. And since then it has over 30 countries in sub-Saharan Africa. It has become endemic and it has gone to Europe, Asia, all over. Now it has become a global problem. But the first documented case was in Kenya in 1921.
All right. Let's pause here for a quick message. When we return, we'll be talking more about the disease. Please don't still go away.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Welcome back, and if you've just joined us, you're still on to Nigeria today, where we're having discussing outbreak of the African swine flu. Some call it the African swine fever in the country. Now, what other issues are likely to arise from this outbreak, Dr. Omada?
Thank you. The consequences of this current outbreak are enormous. The trauma that has been suffered by farmers that have been affected is much. And this has led to loss of livelihood, close down of many farms. In short, some people have even lost their lives when they went to their farm and they saw that maybe all their farms, all their animals were gone. So consequences of this current outbreak, when you put it side by side with the quantity or the amount of money that has been lost to the outbreak, the economy is affected generally, the food chain is affected generally. And you remember that it's not just the direct farmers that are in direct primary production. The entire value chain, suppliers of production inputs are affected. And along the line, so a lot of livelihoods are affected, and that would transmit into a lot of crises within the society. When people are hungry, you can be sure that there will be other consequences, social vices, armed robbery, other things can be associated by loss of livelihood. Thank you.
All right, but is the African swine flu treatable or curable at best, Dr. Aisha?
Well, it's a viral disease, we all know. It is not treatable. It doesn't have vaccine for now. There are a lot of vaccine trials currently going on, even in India, in the UK, in the United States. We are hoping that the vaccine will be available. For now, there is no vaccine, and there is also no treatment. And that is why the best way is actually prevention, biosecurity, top hygiene, to ensure that the disease does not come into your farm. Screening before purchasing of your pigs. We make sure that you screen them against ASF before they come in, and then through our borders as well. Quarantine to ensure that those pigs that come either through land, sea, or air, they are screened, they are free of the infection. But as of treatment, as of today, there is no treatment, and actually we don't even advise treatment. What we advise is total depopulation, as I said earlier, and of course with compensation to the farmer.
Now, you said something that began to get me worried. Are you suggesting, Dr. Aisha, that pigs coming from other parts of the world into the country? I thought that the pigs are bred here in Nigeria.
Not all of them. Of course, like you have indigenous, we also have those that are being imported.
Imported?
From other countries.
Really?
Yes. Is that not true, Dr.
Yes, for breeding purposes.
Yeah.
For breeding, so yeah. It is at the little pigs that you're talking about at the earliest stage of their lives.
Sorry.
At what stage are they? Is this importation
you can bring at any stage, either an adult, just female for breeding, highly maybe higher quality or breeds. Just like you bring any other, like you bring dogs, like you bring horses from some other countries, you can also bring pigs from other countries. There is trade in pigs.
Of course, as well as maybe the semen for artificial insemination.
Yeah.
For the breeding purposes.
For breeding purposes. You improve on the breed that you have.
All right, Dr. Bada, she has talked about, not allowing it to get into your farm, not allowing the swine flu to get into your farm and all of it. But I think the people will need to know too, what are the causes of swine flu?
Yeah, if I understand what you mean by causes, first of all, you've been told that the swine flu, African swine fever, is caused by a virus. So in terms of the pathogen, it is a virus that causes African swine flu. But there are some risk factors that will be associated with the introduction of the disease into a farm. And they include when there's a breakdown of biosecurity on the farm, when there's unrestricted and uncontrolled movement of animals from one farm to the other, especially people that go in to buy animals, moving from one farm to the other to buy animals. At times, they can go from an infected farm into an otherwise clean farm, and they carry the infection along. Because, as I said earlier, infection can be indirectly spread by termites, your clothes, your boots. The vehicle you drive into a farm can carry the virus. Even some food items, feet, can be a source of infection. So those are the risk factors. The non-compliance to biosecurity measures by farmers, poor knowledge on the part of the farmers, and several other factors that constitute a risk to the introduction of the disease into farms.
But once a farm gets the infection, for instance, maybe one is suspected, how can the spread be mitigated?
Well, thank you. Like we said, it is not treatable, and there's no vaccine for it. And once the infection hits a farm, you've heard, the only and the surest way to mitigate it is to depopulate. And by the population, we mean you slaughter the animals that are sick, or the in-contact animals, and you dispose of them. And you prevent people from coming in, buying animals from those infected farms and taking them from one place to the other. Those are some of the measures that you take to mitigate the infection.
Dr. Aisha, would you like to have your say on that? And in addition, is it sustainable to, when you say depopulate and you expect to pay compensation, is it sustainable? Can government afford to do this?
Well, that is what it says. That is the requirement, that when you depopulate, government pays compensation to the farmer. However, there's also also responsibility on the part of the farmer. First, you have to ensure that the farmer himself has put in all necessary measures of biosecurity to protect his animals. Not just you are careless about your farm, you don't care, everybody comes in and there's no biosecurity, nothing, and then your animal gets infected or your farm gets infected and you expect government to pay you for your carelessness. So just like he said, there's also lack of knowledge, not being educated on what to do, but we have a lot of veterinarians out there in the field trying to enlighten our farmers. So there's also responsibility on both parts. But the recommendation is that once you depopulate somebody's farm, it is expected that government pays the farm owner compensation.
In short, that is why we call on farmers, especially those that have large flocks, to make sure that they insure their farms. Because with insurance, at least that can reduce the burden, economic burden on the farmer, if and when it hits.
Now, both of you seem to agree that there is need, for the farmers to be educated, but what level of enlightenment is there? Particularly, let me ask Dr. Aisha that, because you are president here in Abuja, so what level of enlightenment does the association give out to pig farmers?
Veterinarians are doing a lot in terms of enlightenment. We've taken it upon ourselves. Like just recently, last week, even with the COVID-19, we organized, some of our colleagues organized Zoom as interactive forum. They organize a lot of interactive forums for farmers and veterinarians so that we get the information across to them. And it's expected also, if you have invested that much, you have a farm, it's expected that you have a veterinarian that is doing retainership coming there to be in charge of that farm. But if that is a qualified registered veterinarians, and that is why the issue of quackery also comes in. Some farmers like to cut corners instead of getting a qualified registered veterinarian to be the person consulting in your farm, giving you that you go ahead and you get the wrong person, somebody that is not really qualified because he's charging you less. So I advise Nigerians, farmers, that they should be able to engage the services of qualified registered veterinarian that should be able to give them quality service to protect their farms.
And the veterinarians that you talk about, is there a kind of continuous education on their own part so that you get them abreast of best practices as they evolve?
Yes, definitely. As the president of the Veterinary Council of Nigeria, part of the mandate of the council is ensure quality of veterinary profession in the country, and we organize a routine continuing education program to update our colleagues on the profession. So, and it is mandatory for you to attend such continuing education programs. We make it as a standard, as before you can get your next annual practicing license, like for next year, you must show proof that you have attended at least a minimum of two continuing education programs in 3 years. So, and then apart from the mandatory ones, we also organize regularly training on subject matters. Like just 2 days ago, we had an interactive discussion on this African swine fever, where veterinarians, over 300 veterinarians, key into a Zoom program where we had specialists speaking to them on advanced ways of recent methods, technologies in the treatment or management of African swine fever.
All right, Dr. Aisha Abubakar Baju, Commissioner of Police and Head of Nigeria Police Animal Branch in Abuja. Thank you for coming on Nigeria Today.
Thank you very much for having me.
And an equal measure of thanks to Dr. Peter Omana, Chief Veterinary Officer and Epidemiologist, Federal Ministry of Agriculture. And many thanks for your perspectives.
Thanks very much.
Now, Nigeria Today is live every weekday at 7:30 in the evening, and you can watch these and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azo. Thank you for your time.
You can follow us on all our social media platforms: Facebook at NTA Network News, Instagram at NTA Network, Twitter at NTA News Now, YouTube at NTA News Online. Or visit www.nta.ng. For live streaming, visit www.nta.ng/live. Now, you can stay updated on the go, be it on your TV, iPhone, laptop, or iPad, or download the NTA mobile application from your Play Store or App Store. NTA, you can beat the rich.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water, or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
24 hours a day, 7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment. Then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International, your window to the world.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Welcome to Abuja, the place that unites Nigeria.
Good morning and welcome to the news at 10 on the network service of the NTA. I am Claire Adilabu Abdurazak.
And I'm Abdul Malik Agdio. It's good to have you join us on the news. We'll begin with the headlines.
NCDC records over 700 new cases of COVID-19 in 20 states and the FCT.
And Presidential Task Force on COVID-19 appeals for an end to resident doctors' strike for protection of the nation's public health.
This very complicated period, I want them to consider the appropriateness, whether this is the best time to press so hard their demands at the expense of exposing the entirety of our people to the scourge of COVID-19.
President Buhari gives marching orders to security agencies on peace and security.
The security agencies must justify the leadership by not disappointing the populace.
Plus, on World Sickle Cell Awareness Day today, correspondent highlights trends and efforts.
Good to have you join us on the news. Let's begin with an update of COVID-19. Nigeria has recorded 745 new cases of COVID-19 as announced by the Nigeria Center for Disease Control, NCDC. Now, the 745 new cases brings the total number of confirmed cases to more than 18,400 in the country. In the breakdown, Lagos has 280, Oyo has 103, Ebonyi has 72, the FCT has 60, while Imo has 46. Edo State recorded 34 new cases, Delta 33, Rivers State has 25, while Kaduna has 23, Ondo has 16, Katsina 12, Kano has 10, and Bauchi has 8 new cases. Borno has 7 new cases, while Kwara has 5, Gombe has 4, Sokoto and Enugu states recorded 2 new cases each. Others are Yobe, Osun, and Nasarawa states with 1 new case each. Lagos is still topping the list. That's Nigeria's COVID-19 chart with more than 7,800 cases. Next is the FCT with 1,451 cases, and it's followed by Kano State with 1,170 cases. So far, 6,307 have recovered from COVID-19 virus, while 475 deaths have been recorded so far.
Now, the Presidential Task Force on COVID-19 has appealed to the National Association of Resident Doctors to call off its ongoing nationwide strike in order to safeguard the nation's public health amidst the COVID-19 pandemic.
Chairman of the task force and Secretary to the Government of the Federation, Boss Mustafa, made the appeal at Thursday's briefing in Abuja. Amitari Ipen was there.
The threat by the National Association of Resident Doctors that its members in COVID-19 isolation and treatment centers will join the ongoing strike if their demands are not met is a source of concern.
Is it the appropriate time to take such drastic and adverse measures on issues that were negotiated some 6-7 years ago? This very complicated period, I want them to consider the appropriateness whether this is the best time to press so hard their demands at the expense of exposing the entirety of our people to the scourge of COVID-19.
While appraising 3 months of its mandate, the task force says global experiences and local peculiarities have guided its national response strategy of prevention, contact tracing, isolation, and treatment for COVID-19.
We have updated case management guidelines with reviewed changes like discharge criteria and medication used. Our treatment centers will also be getting an advisory to test the applicability of a drug recently repurposed and announced as being effective for treatment of COVID-19.
It is mandatory for masks to be worn in public spaces. Masks are supposed to cover your nose and mouth.
Until everybody takes ownership of this pandemic, very little will be done. And this is why we are enlisting national rulers, faith leaders, and opinion leaders.
On the planned resumption of domestic flights,
we'll have some work to do. As such, June 21st is not a feasible date to resume operations domestic. The Civil Aviation Authority, despite all pressures coming from all quarters, will not approve the start of operations any date until we are sure and we confirm that we are ready to start in a safe, secure, organized, and efficient manner.
Nigerians are advised that the risk of contracting COVID-19 is higher at this stage of community transmission, hence the need to adhere to all precautionary guidelines. In Abuja, Mitaire Ikben, NTA News.
Still on health matters, the Minister of Labour and Employment, Dr. Chris Ngige, has appealed to the resident doctors to call off its strike, as such action is not in the interest of the nation. The minister, who was speaking on NTA's current affairs program Nigeria Today, said the Nigerian Association of Resident Doctors should make its claims known to the Ministry of Health instead of just embarking on an industrial action in a pandemic. Ngige highlighted efforts made so far by the federal government to ensure that the issues raised by the resident doctors are addressed.
And insurance companies have what they call no cover, no claim. So, but right now there is a cover. And this cover has even been extrapolated for all Nigerian workers. All. In case anybody loses his or her life during this pandemic, the family can lay claim. I have told them that. We also have top-up for medical people. Top-up that were donated to the PTF. I got the PTF to get that top-up life insurance to give to medical people only. And that's what we are doing. So NAT has to go and make their claims, list their members that have lost their lives, and give it to their main ministry, their main employer, which is Federal Ministry of Health. We also have another insurance for them, for those who have gotten invalidation.
That's the Minister of Labour there, Dr. Chris Ngige, speaking on the nationwide strike by resident doctors. Nigeria Today is broadcast every weekday at 7:30 on NTA News 24. Now to security. President Muhammadu Buhari has directed the nation's armed forces and other security agencies in the country to immediately reverse the current worrisome national security, describing it as intolerable.
Addressing the top brass of the nation's security architecture summoned to a crucial meeting, the president was emphatic that their best is so far not good enough towards restoring the desired peace for national development.
President Muhammadu Buhari summoned the meeting in response to the declining security situation in the country, which according to him is very embarrassing. During the closed-door meeting with the operational heads of the various security services as well as their intelligence components, the president described as unacceptable the continuous attacks and killings of defenseless Nigerians by criminal elements. The National Security Advisor, Babagana Munguno, who addressed newsmen after the meeting, said President Buhari has virtually lost his cool.
He is extremely unhappy about what is happening, and he feels that even though the security agencies are doing their best is not good enough for him, and he wants an immediate reversal of the current trend, an immediate reversal of our misfortunes in all their dimensions.
In no uncertain terms, the president told the security chiefs that none of them was forced on him. Rather, he selected them individually based on available records, and therefore living up to their expectations is a task that must not be compromised.
And therefore, he wants the security agencies to take into consideration the wider implication of the gradual descent of the security of this country. The security agencies must justify the leadership by not disappointing the populace. He is not going to accept any further escalation of the security situation.
President Buhari said unless the nation is effectively secured, the pursuit of national development objectives will be an exercise in futility. He said the proliferation of drugs, small arms, and light weapons must be checked, so also the use of unregistered SIM cards.
Mr. President has directed that I, as a National Security Advisor, should link up with the Honorable Minister of Communications and Digital Economy to work out a blueprint to ensure we wrestle the irresponsible use of these SIM cards. Of course, I have my colleagues, the Inspector General of Police, the Director General of the Department of State Services, to help in this issue.
The Nigerian leader was also emphatic that he will no longer tolerate the reported lack of synergy within the security sector.
And he has left us in no doubt. The convergence of efforts, the confluence of all ideas, be they operational or intelligence, must be achieved so that we no longer, if at all, there was this notion that groups were working in silos or stovepiping, they desist from that with immediate effect. We must have a central platform to coordinate all the efforts of operations and security. It is also incumbent on the wider Nigerian population to key into whatever the security agencies are doing.
The National Security Advisor told journalists that the security chiefs assured the president at the meeting that they will not only redouble their efforts, but do whatever it takes towards reversing what he called their dwindling fortunes for the betterment of the country. From the State House, Adamu Sambo, NTA News.
Thank you, Adamu Sambo. You're watching the news at 10 on the network service of the NTA. We're broadcasting live from Abuja. We have more news to come.
Ministry of Information and Culture partners with Women Affairs on national campaign against rape and gender-based violence.
Between January and May this year, about 800 suspects were arrested, while 631 cases were conclusively investigated.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Now, the gift of good health is taken for granted by many people. However, some individuals are not fortunate as they are born with disorders that they have to live with, and that's, of course, due to their genetic predisposition.
And sickle cell disease is one of such disorders. Now, correspondent Uche Ugochukwu tells us more about sickle cell as the world celebrates the effort so far made with a mantra to fight it.
The prevalence of sickle cell traits ranges between 10 to 45% in parts of sub-Saharan Africa, with Nigeria recording about 20 to 30%. 39-year-old Mark and 19-year-old Hope are among the 2 to 3% of Nigeria's population with tales of excruciating bone pains, bacterial infections and anemia due to sickle cell disorder.
Get to have serious pains, excruciating pains really.
A lot of challenges, like now. My mates, they are ready for their exams, but I'm here. Before, I was stay like 3 years. I haven't been to the hospital, but now, because of exposure to cold and not taking drugs regularly, and water again, the crisis started coming regularly.
Intending couples are advised to know their genotypes before marriages.
Imagine you as a mother taking care of a child about 18, 19 years, cleaning her up, wearing her things. You know, it's not easy. That this condition come is not her fault. It's not neither our own fault, because that at that time we're not exposed so much that we know to go and do tests, genotype tests, all those things before we get married.
For them to prevent this crisis, we encourage them to avoid strenuous activity because that also predisposes them to crisis. For people that are in school, we don't allow them to do all the rigorous activities that happens in school. So that's another way they do to prevent it. They sleep under malaria-treated nets so that they won't have malaria infection. They try to keep themselves warm, especially during cold season.
Although Mark is not in serious condition as Hope, he appeals for legislation to assist sickle cell carriers in society.
I am a graduate, I am a civil servant, really, but a lot are not fortunate like some of us to be employed, and it's a tough one, trying to manage to get drugs, trying to get finance to come to the hospital when in pains, and a lot of challenges, particularly when the complications as a result of the blood challenge starts coming. It's a tough one. We need help. Government need to subsidize a lot of things for sufferers so that they can live up to their potentials.
World Sickle Cell Day aims at raising awareness about the disorder, which symptoms manifest from age 5 to 6 months. Uche Ugochukwu, NTA News.
Very sad indeed. Now, reports show that over 300,000 children worldwide are born with the sickle cell disorder, and every year, and over half of those children may die before the age of 5.
Nigeria has the highest burden of sickle cell disorders in the world, and the 19th of June every year is set aside to commemorate the World Sickle Cell Day to celebrate patients and raise awareness about this non-contagious disease.
And that's why we have joined us here in the studio Rabbi May Dunama, who is the founder May Dunama Sickle Cell Foundation. We'd like to thank you very much, Rabbi, for joining us on the news at 10 on the network service of the NTA.
Thank you.
As someone living with the disorder, can you give us a sense of the weight of the burden that you have to carry?
Well, living with sickle cell is a life of pain, you know. Aside this physical pain you go through when you're having a crisis, there's also the emotional, psychological, you know, torture and all that. So it's a life of challenge, you know. Being born with sickle cell, I had everything I wanted, thank God, coming from a privileged home and all that. But I still went through a lot trying to cope with this disorder, because really it doesn't stop the pain when the crisis comes, you know. And that pain is, I don't know if to describe it, because some nurses used to tell us in the hospital, it's not as bad as labor pain. Why are you crying? This, that, and also I always tell them, okay, I haven't been through labor, so I don't know, but I know that what I'm feeling is equal or more than the labor pain you're talking about. Maybe at a point where I'm able to compare it, then I know which one is more painful. Because sometimes it's like you have hammer, you know, like a hammer hitting all parts of your body, you know, the bones and all that, and it's continuous. When it starts, it's about last like 3 days to 1 week. You have continuous excruciating pain, and the painkillers only just come in, and then after they elapse, the pain continues again, and that's it. And aside that, of course, you miss school. You miss other physical activities your peer groups are having. You cannot swim, you cannot play in school, you can't do so many things. And then, of course, it's the discrimination and, you know, the stigma and all that comes into play. So that affects you psychologically and all. So it's just it's a very challenging disorder to live with. Yeah.
I think I can relate on some ground, Claire, because of the fact that, you know, I have cousins who are sickle cell anemic and they go through this pain. But it is advised that, you know, people should actually get married for all the right reasons. But we find out that, you know, people do get married for, you know, wrong reasons as well, as many Nigerians do not understand the pain sickle cell patients actually go through, you know. And this could be avoided with just a simple, you know, blood test before marriage. How important is it, you know, for people to get tested before getting married?
Oh, it's very important. Sickle cell disorder is one of the, you know, preventable diseases is 100% preventable as long as you have the right test done and then you have a compatible partner. Then you can completely avoid bringing forth children with this problem. So I think that's a good start to break the cycle, right? And just marry the right person. You know, if you're a carrier, AS or AC, you avoid getting married to the same person with the same genotype like you. And then it's not contagious, and then it cannot be transferred to offsprings, because I have sickle cell. If I get married to a man with AA genotype, that's it. You know, the cycle is completely broken. So I think partners should put that into consideration, because they really don't have any right, you know, just bringing in children with a problem that will last a lifetime, which will also affect them. But they don't understand. When we're doing counseling sessions, they think that, okay, God is going to make a way, or it's something they can actually live with. But our parents in the olden days, I think, were more patient and all that than now, because so many challenges are going on now. If you dare bring in a child with sickle cell, that alone, there's so many divorce cases and all that. So because of this factor, there's so many abandoned mothers and children because of this genotype issue. And then, of course, it comes with the challenge of getting the wrong diagnosis, wrong tests, and then people just get married and find out that, okay, I'm AS, and the result shows me that AA. So that comes into play as well. So I think we advise people to actually do it 2 or 3 times to be sure before you get married.
All right, Rabbi, thank you. Now, it's a good thing that you have said from your experience that the cycle, you know, can be broken, of course, with simple knowing your, you know, gene type. The figure we read earlier on says that over 300,000 children are born, you know, worldwide every year. So, which means that we're still having increasing number of, you know, children living with the disorder. So, what impact has a day like this made, you know, to reducing the number of children born with the disorder?
Well, part of the challenges we face is the rural communities, right? We have the cultural and religious beliefs coming into play most times, and people still believe that this is not a medical condition. So the more we reach out to the grassroots, or the more the government and other agencies reach out to the grassroots, the better. Because like in the north where I come from, you can just sit down in the sitting room and just have a marriage ceremony. As long as you have your witness and the guy has his witness, we can just be in a sitting room and then they give the hand out in marriage, and nobody really cares to know, okay, this is where is your genotype result. And we must commend the churches for bringing into play, like they always try to actually demand for genotype and HIV and all that. That's a good start. If we can extend this and make it a national policy for most religious bodies to start with, to act on this one. I know some in the north have started. If we can do that, that's a good start, because of course in Nigeria we respect our culture and religion very, very well.
Okay. So
yeah.
We need to end our conversation because of the time, but quickly before my colleague Malik asks the question, share with us briefly, how have you been able to manage to live through all these years? You know, what are the do's and don'ts for you? Because you're strong. You watch the report from our colleague. You know, some of those who are living are in the hospital. But how have you managed to live through it?
Yes, as I mentioned earlier, my parents have been very supportive, and of course I've had access to good medical care around the world. My mom has been the backbone that has, you know, always motivated me and pushed me. So it starts with love, you know. With love, you can do anything. So that's why we can encourage patients to do that. So I've actually managed my do's and don'ts because I have access to good medical care, good drugs and all that. And with management drugs, sickle cell patients can actually live a relatively normal life. And with education on how to manage themselves as well, they can actually live a good life. That is why we have the lifespan, increasing by the day. So I've had all that, and I'm learning every day on how to manage it. And so I avoid malaria, I drink a lot of water, I avoid vigorous activities. I also try to, my folic acid is on my dressing table, and all that. So I try as much as possible as an adult to keep up. That's why I'm here talking today, yeah.
All right.
The grace of God.
You talked about advocacy now. You talked about national policies, and you talked about love too. What's the general advice for Nigerians regarding sickle cell?
Well, I think, as mentioned earlier, you have to put this into consideration. 1 out of every Nigerian, 1 out of 4 of every Nigerian is either a sickle cell carrier or already has sickle cell. So we're talking about 25% already affected. So what are we doing? It's like a time bomb waiting to explode.
Rabi, I'm sorry. Yeah. I'm sorry. I'm sure you've shared enough. I'm sorry. I have to really interrupt you at this point. We just have to take our break now. Thank you. Thank you, Rabi May Dunama, for sharing your experience with us on World Sickle Cell Day.
Thank you.
Right, you're watching the news at 10 on the network service. Time for us to take a short break. Don't go away. We'll be right back.
Nigeria, a nation of great people, different tribes and languages, yet we are united in our diversity. All over the world, Nigerians are known to be very hardworking and resilient people. In our history as a nation, there have been many storms, but just like the eagle, we always soar very high above the storms. Together, as a nation, we stood against Ebola virus disease in 2014, and we conquered. Together as a nation, we shall stand against COVID-19, and we shall surely triumph. Let's do our part as citizens, obey the health authorities, stay at home, practice social distancing and proper hygiene. When this is over, and very soon it will be, we shall dance again at the Calabar Carnival, the Eyo Festival, Celebration, Ojudeoba Festival, and Aragongo Festival. When this is over, and very soon it will, we shall flock the beaches again. We shall attend our music concert again. We shall invite the world once again at the Lagos City Marathon. When this is over, and very soon it will be, we can return to our